New South Wales Health Minister Brad Hazzard has guaranteed the reopening roadmap will not change even after a new leader is installed on Tuesday. New rules around isolation requirements have been outlined as cases and hospital admissions continue to fall on Sydney's 100th day of lockdown.
The pandemic partnership between Dr Kerry Chant and Gladys Berejiklian is over.
The Premier has worked tirelessly since the pandemic commenced through this most difficult time, and I think her clear commitment to the community is so evident.
The Health Minister also paid tribute.
I think she has been an amazing Premier, a person of high integrity, and somebody that I would place my trust in completely, and I think that's what the community of New South Wales has done as well during these last 20 months. And it's just awfully sad that it's come to this situation.
Speculation continues to mount over who will be sworn in as Premier on Tuesday. Treasurer Dominic Perrottet is the rumoured frontrunner ahead of Planning Minister Rob Stokes. Dominic Perrottet has been against lockdown extensions in crisis cabinet and has argued throughout the crisis that it's time to change our thinking around COVID, learn to live with infections in the community with less restrictions on business. If Dominic Perrottet does win the contest on Tuesday, it could put him on a warpath with the Chief Health Officer. But the Health Minister Brad Hazzard has made this guarantee.
The roadmap has been very carefully worked on by the entire public health team, and it will definitely stay the same unless, of course, circumstances change in terms of the numbers of the cases. It will change only in the sense if there's some medical issue that requires it to be revisited.
10 more people have died. Despite that, the roadmap appears to be working.
To have gone from 1,599 cases just 3 weeks ago to 667 cases today has taken a lot of hard work, a huge amount of work.
Hospital admissions have fallen below 1,000 to 981, and those more acute cases in ICU is now at 195, down from 202 in the previous reporting period.
That's pleasing. The modelling will be rerun based on that, but they are tracking beneath the modelled estimates.
And vaccination rates are still climbing. 88.1% have had one dose, 66.5% are fully vaccinated. When the 70% fully vaccinated roadmap begins on October 11, there will be new isolation requirements for those who are vaccinated. If you test positive, you must isolate for 14 days, regardless of your vaccination status. If you are deemed a close contact and are fully vaccinated, you may be required to self-isolate for 7 days and on the 6th day, return a negative test. Following your negative test, you must work from home if you can and not visit any hospitality settings for a further 7 days.
The majority of the cases will occur in that full first 7-day period. So it's just taking that risk assessment that in those settings, that those groups, if they remain well at day 7, have that test at day 6, then they've got a very little chance of becoming infectious afterwards.
Unvaccinated close contacts must self-isolate for a full 14 days as per the current requirements. Businesses can self-assess risks using guidelines on the New South Wales Health website if there is a positive case identified, but must notify New South Wales Health if there is 3 or more cases in a 7-day period. Kenny Heatley, Sky News, Sydney.